Sildenafil is a medication that can be given to you to treat erectile dysfunction. However, it should be properly used for a better response. It is not suitable for all people. Few medications should never be taken with sildenafil. However, a few other medications can be used with caution. Therefore, before using sildenafil, you should know key facts about this medication, like what is the best time to take it, how it improves your condition, which other medications should be avoided, what is the effect of alcohol, and many more. In this video, we will cover such 12 key facts about sildenafil. First, when to take this medication. Sildenafil is a short-acting PDE5 inhibitor. It shows its actions up to 3 to 4 hours. Therefore, you can take any time within this time period. You can take at least 30 minutes before the intended activity. Remember that sildenafil can't work without sexual arousal. Therefore, it should be taken according to the intended activity at any time between 30 minutes and 4 hours. However, it is always better to take 1 hour before the sexual activity for a better response. Even though sildenafil can be taken with food, it is better to take these tablets on an empty stomach. Food, particularly high-fat meals, may delay the action of sildenafil. You can take sildenafil with either plain glass of water or fruit juice. However, never take with grapefruit juice. A few chemicals called furanocoumarins in grapefruit juice will inhibit the metabolism of sildenafil. This may increase the exposure of this medication to your body, which ends with increased side effects. Second, how much to take. You can get sildenafil tablets in 2 variants. One is intended for treating erectile dysfunction, and they are popular under the brand Viagra. These tablets are available in 3 strengths: 25 milligrams, 50 milligrams, and 100 milligrams. They are given only once daily. The second variant of tablets is intended for treating pulmonary arterial hypertension, and they are well known under the brand Revatio. These tablets are available at a single strength of 20 milligrams. These tablets are given 3 times a day. Therefore, these 2 variants of tablets are not equivalent and differ in their usage. Sildenafil is also available as an injection and oral solution for treating pulmonary hypertension. For treating erectile dysfunction, the typical dose of sildenafil is 50 milligrams, taken only once a day at 1 hour before sexual activity. Your doctor may increase the dose to 100 milligrams if a significant response is not observed. However, it is the maximum dose that should be used only when highly essential. Never take sildenafil beyond this dose. It may produce very serious complications. If you have any liver dysfunction, your doctor may reduce the dose to 25 milligrams. For treating pulmonary arterial hypertension, sildenafil is given at a dose of 20 milligrams 3 times a day. Third, use with nitrates. Never take nitrates with sildenafil. Nitrates are used to reduce pain in the angina. Medications like nitroglycerin, isosorbide dinitrate, and isosorbide mononitrate are commonly used nitrates. These medications release a tiny chemical called nitric oxide. This results in dilation of blood vessels supplying the heart, which reduces pain. You can see that both nitrates and sildenafil produce the same effect on blood vessels. They cause dilation. Interestingly, they also connect at the same pathway. Nitrates release nitric oxide, which activates an enzyme called cyclic GMP. The same enzyme levels are also elevated by sildenafil. Therefore, combining nitrates with sildenafil can cause a significant reduction in blood pressure. It may also lead to syncope and life-threatening complications. That's why nitrates should be avoided with sildenafil. If nitrates are needed to control angina pain, they should be administered at least after an interval of 24 hours from the last dose of sildenafil. You should use sildenafil cautiously with other vasodilators like alpha-1 blockers. Medications like prazosin, terazosin, and doxazosin come under this category. They are used to treat hypertension. However, they cause significant hypotension and dizziness when combined with sildenafil. Fourth, effect on heart. Sildenafil causes dilation of blood vessels in your lungs. This may indirectly affect the function of your heart. However, if you have any existing occlusive disorder in VN supplying to your lungs, you should avoid taking sildenafil. Sildenafil can reduce your blood pressure and can affect its circulation. Therefore, if you have had any heart problems in the past 6 months, this medication should be used with caution. If you have recent heart attacks, heart failure, or unstable angina, use of sildenafil may not be recommended. Fifth, effect on hearing. You should be careful while using sildenafil, as this medication can affect your hearing abilities. You may have dizziness and lightheadedness with use of sildenafil. This is quite common, as this medication causes dilation of your blood vessels and reduces your blood pressure. However, if you notice other symptoms like any noise or ringing in your ears, it may indicate an effect on your hearing. You may also observe a reduced hearing or even sudden loss of hearing. You should be careful to notice any changes in hearing as early as possible. Sixth, taking with alcohol. You can drink alcohol while taking sildenafil. However, you should limit its intake for two reasons. First, alcohol can make you dizzy and less attentive. Taking large amounts of alcohol simultaneously with sildenafil may severely impact your attention. The second reason is that taking large amounts of alcohol can reduce erection. Therefore, the effectiveness of sildenafil may be reduced in the presence of a high intake of alcohol. Seventh, how sildenafil works. Sildenafil works by dilating your blood vessels. It is classified as a phosphodiesterase 5 inhibitor. In people with erectile dysfunction, blood vessels supplying erectile tissue are insufficiently dilated. This results in failure of erection. Dilation of blood vessels is carried by an enzyme called cyclic GMP. It is an enzyme that causes phosphorylation of proteins in vascular smooth muscle that prevents entry of calcium and inactivates contractile proteins. This results in relaxation of blood vessels leading to erection. However, the action of cyclic GMP is limited by its breakdown. An enzyme called phosphodiesterase type 5 is responsible for the cleavage of cyclic GMP. Sildenafil inhibits this cleavage enzyme, thereby increasing the levels of cyclic GMP in vascular smooth muscle. This results in dilation of blood vessels supplying the erectile tissue, improving erectile dysfunction. In pulmonary hypertension, sildenafil works in a similar way. It causes dilation of pulmonary arteries and reduces blood pressure. Eighth, common side effects of sildenafil. One of the most common side effects observed in many people is the headache. You can observe this side effect from the first dose itself. The severity of headache increases with doses beyond 100 milligrams. Sildenafil can also cause dilation of cranial blood vessels that can induce headaches. You can also feel dizzy and lightheaded. Flushing can be observed, leading to redness in the face and neck. You may have indigestion with use of sildenafil. You can have congestion in your nose again due to the dilation of nasal blood vessels. In a few people, sildenafil may cause muscle pain at the back and limbs. Ninth, prolonged erection. Sildenafil is a short-acting medication. It has a half-life of around 3 to 4 hours. Therefore, it can show its effects up to a few hours. Normally, the erection can be reduced after ejaculation. However, in a few people with structural abnormalities in the penis, the erection may last up to 4 hours. This prolonged erection is called priapism and is highly painful. It even causes further damage to the erectile tissue. The risk of prolonged erection can be enhanced by the presence of cancerous blood cells. Therefore, if you observe any prolonged erection, immediately stop this medication and consult your doctor. 10th, use in children. You may be given sildenafil for other purposes. It can be used in a condition called pulmonary hypertension. It is a condition of elevated blood pressure in the blood vessels supplying the lungs. This results in increased resistance to blood flow and makes it harder for the heart to pump blood into the lungs. It significantly impacts the functioning of both lungs and heart if left untreated. Sildenafil can be used to treat this condition. It can cause dilation of arteries supplying the lungs and improve blood flow. For this purpose, sildenafil can be used both in adults and children. It can be given to children with an age above 1 year. 11th, effect on vision. In men over 50 years old, sildenafil may affect the neurons supplying the eye. You may not be able to discriminate colors properly. However, in people with defects in the optical disc, sildenafil should be carefully used. If you have a low cup-to-disc ratio, a sudden loss of vision may be observed with the use of sildenafil. A few risk factors, like elevated levels of cholesterol, coronary artery disease, chronic hypertension, and diabetes, may also cause damage to optical neurons. However, loss of vision may not be observed in all people, and it is particularly more pronounced in men with pre-existing structural abnormalities in the eye. If you observe any sudden loss of vision, immediately stop using this medication and consult your doctor. 12th, when to avoid. If you have a recent heart attack, stroke, or serious heart problems, Use of sildenafil is not recommended. As sildenafil can affect vision, it should be avoided in people with genetic eye disorders like retinitis pigmentosa. Sildenafil is not suitable for you if you have serious liver problems, sickle cell anemia, or unstable angina. These are the 12 essential key facts that you should know before taking sildenafil. Right use of sildenafil at the right time is very important for a better response. A better idea and quick look at the possible side effects will make you use this medication safely and wisely. That's all about this week's story. Thanks for watching this video, and if you find any interesting facts on this medication, please share them in the comment box below. Please do subscribe and hit the like button. I will come with another interesting video in the next week. Until then, have a nice time, take care, and goodbye.